Hi, this is Mike Stoffel with a quick video about our end of the year forms for licensed staff. So it's really important that you fill out the end of the year forms, and we're going to talk about how you can do that. There's a QR code in the upper right hand corner that will take you to the open enrollment page and later on to the end of the year forms page. I think it's been a pretty successful adoption of ease so far, so special thanks to Janet Anderson and Mr. Nelson in HR for helping smooth out the process for our members. So we're going to address medical, health savings account, medical insurance, the health savings account or HSA, flex spending, dental insurance, life insurance, our VIBA, and I should have updated this to benefits extra, and then the matching benefits here as well. So the first thing we're going to talk about with insurance is basically what are my risks. Your first kind of choice here is down to 2 now with PEEP. So you're going to have the Advantage High. That's our lowest deductible plan. That's that kind of ante into the pot. Those first dollars you spend out of your pocket, that's very low, but it's got the highest monthly premiums. And those numbers, $368 and $1,035, are monthly premiums after the contribution that licensed staff get. On the other end of the spectrum is an HSA. This has the highest deductible. And again, think about that as your ante into a poker game. It's the first dollars you're going to spend, but it has the lowest monthly premiums. So you can see for singles, the monthly premium is $89, and for families, it's $291. It's important to note this is at least the third time we've had a zero or reduction in our monthly premiums in about the decade that we've been with PEEP, and we think that's fantastic. Just a reminder about the district contribution. It is $561 for single insurance and $1,422 for family insurance for licensed staff. So you probably want to ask now, like, hey, well, what is the overall cost? You can see the overall cost for the monthly rates is, for that high plan is $928 for singles and $2,457 for family. That's before any district contribution. If you look at the chart below, what's your monthly out-of-pocket costs? That's where we get to that $368 and $1,035 for the high plan, or for the HSA, that $89 and $291 a month. So, first thing you want to do is you want to look at the cost level of your clinic. Cost level determines what's going to be your deductible amount as well as your out-of-pocket maxes. It's important to note on the high plan, right, cost level 1, the deductible is $250 for a single. Your out-of-pocket max is $1,700, and then your out-of-pocket prescription max is $1,050. So what we want to look at here is really the total liability, this number down at the bottom here. It's a combination of, in your worst case scenario, what is the maximum amount of money that you would spend out of your pocket. So you can see if the high plan is $12,420 in monthly insurance premium contributions from your pocket, and then you could max out overall if you hit your $500 deductible, $3,400 max for medical services, and $2,100 for out-of-pocket max for prescriptions of $18,000. On the other end, right, we're going to see some differences here already. So I've got a lower, let's say, out-of-pocket contribution to health insurance. That's that $3,500 per year. But I have a higher first dollar deductible as a family, and I have a greater out-of-pocket max. So again, it's about the amount of risk that you're willing to take on. If you're relatively healthy and you don't use the doctor a lot, you might want to look at the HSA. If you have some chronic conditions, right, or you know you have some prescriptions that can have high monthly costs, you probably want to spend more out of your pocket initially in that monthly contribution rather than maybe using that prescription that renews every 90 days or so. At cost level 2, again, what you're going to see is a slight increase in those first dollar deductibles, up to $400 and $800 for the high plan, and if you're on the HSA plan, $2,250 And again, it comes down to the risk that you're willing to take on. And again, at cost level 3, again, another increase, $750 for the high plan for singles, $1,500 for family, and on the HSA, $3,250 for singles and $6,500 for family. So, what do I do about insurance? Well, our second step here is really to look at our primary care clinic. And that primary care clinic determines the cost level, and that cost level determines your first dollar deductible. So you can access that information on Innovo. It's on the Open Enrollment website. If you click into this presentation, it'll bring you to a spreadsheet that you can download. And you can see the primary cost clinic. So I'm just going to quickly go to Innovo MN. You can click into the PEEP active groups and then click into the clinic directory. Now, because I've done this quite a bit, I have a spreadsheet in my Google Drive already for the costs of the clinics. It looks like this. I've formatted mine a little bit, but you'll be able to download it yourself or again access it on the district website. So there are two choices to make once you've chosen that primary care clinic. I'm going to choose either Blue Cross or Health Partners, whoever my preferred provider is. So again, you can go to Innovo and click on that PEEP clinic directory. It'll look like this. For example, my family, we go to Anoka and the Riverway Andover clinic. You can see there's a difference though, right, between costs. So here, Riverway Clinics Andover through Health Partners is cost level 1. If I go just down the road to MN Health Fairview through Health Partners, it's cost level 3. But if I wanted to go to the M Health Fairview Clinic in Andover, I'd probably choose Blue Cross because it's a cost level 2. Now, for my family, we don't have a pediatrician or primary care doctors, so we always go with the lowest cost clinic for us, which is that Health Partners Riverway Clinic Andover. The clinic directory includes clinics all over Minnesota and western Wisconsin, so if you have children that go out of state, they'll need to choose that primary care clinic. And then the number you're going to want to know for when you enroll in EASE is this number right here. So 2254 for Health Partners Riverway Andover, or this long one for Health Fairview in Andover. So just make sure you get that primary care clinic and make sure you have that when you're using EASE to get logged in. Speaking of EASE, EASE is the online platform. It's also where you can decide how much you are going to contribute to your HSA if you have an HSA compatible plan. If you don't, remember that amount is going to go towards a healthcare savings plan, which you can use at retirement. So the district contributes their licensed staff $117 a month, or about $1,400 per year for an HSA. You can, as a single, contribute an additional, almost $2,900, or a family almost $7,100 additional dollars toward that HSA. And what that should do is help cover those out-of-pocket maxes if you'd ever get to those points. Okay, so that's why it's important to put aside some of your money. Maybe you're saving on monthly premiums to make sure you have it in your HSA, so when those medical bills do come with your healthcare savings account, you are able to pay it out of there and don't have to really pay it out of your pocket. It's kind of like planning ahead of time for those medical expenses. If you have an HSA, you should not be using flex spending for medical care. Make sure you're not using flex spending for medical care if you have an HSA. Now, if you're on the high plan, you have to use flex spending. Flex spending can also be used for child care. So again, you can see the numbers on the screen there, $2,500 max if you're filing separately for child care, $5,000 per household. The bad part about flex spending, and this is why if you have an HSA, you don't want to use it, is if you don't use that money, it's lost. One of the advantages to flex spending is it lowers your taxable income. So that can be really important to people, especially if you're a young family, if you got 2 or 3 kiddos in daycare, you really are able to lower your income to avoid those additional taxes. For flex spending, there are reimbursable expenses. We've got a link to that here. It can be used for co-payments or prescriptions on dental, orthodontics, eyeglasses, other healthcare goods and services as well. Next part of insurance would be dental. Here are the dental rates. They've gone up slightly over the past year. I think it's about $8 for family, $6 for employee, and about $4 for single. The district contribution is $40 for single and $40 for family at this point. So just make sure you know what those dental premiums are. It's important to note you can go twice a year. Your dental visits do not have to be spaced out every 6 months. Make sure you check with your dentist that they understand that about our insurance. It's not every 6 months, it's twice a year, okay? Remember, in ease, designate those beneficiaries. Worst case scenario, if you are not here, you want your beneficiaries to get that money that you have earned and you've set aside for them. So please, please, please make sure you fill out a primary beneficiary and secondary beneficiaries. That could be your spouse, aunt, uncle, brother, sister, whomever it is. Make sure you get those percentages to add up to a total of 100%. So in my case, my wife Alicia works in the school district. She's my primary beneficiary. Secondary beneficiaries are my 3 children, and I've divided it up in between them. So again, please make sure to take the time to fill out that beneficiary form on ease. This is really important for the worst case scenarios that we hope no one faces, but sometimes unfortunately things do happen. So matching benefit for 25-26. This is where things got a little complicated last year. It's important for licensed staff to know we are selling our sick leave moving forward. So what that means is I'm not looking back at 24-25, I'm looking forward to 25-26. So there are 3 things you can get for that matching benefit. So you can go right to your 403B, and the district might match it if you still have money left under the cap. You can go towards a Roth contribution, or you can sell it for cash. If you're doing a payroll deduction, that'll happen automatically up to $2,000. The career cap was increased to $24,000. You can't sell more than 116 hours total for cash, 403B matching, or 403B Roth, okay? So what does the form look like? Well, the first thing you're gonna do is you're gonna go to Skyward and look up how much sick leave you currently have and then add 116 hours. You have to have 320 hours in order to be able to sell any back, and then you just follow through with the options. Make sure, if you're selling back sick leave, you wanna circle Roth. You're already being taxed on that money because the IRS wants their chunk of it. If it goes to your 403B, it'll be taxed again at withdrawal. So it's very important you want to circle Roth. Contributions to our 403B or 403B Roth max out at $2,350 per year with an additional $7,500 if you're 50 plus years old. Now, if you're an old timer like I am and you've already hit that $24,000 cap, you can sell up to 116 hours. So this is that beyond the district match box at the bottom of the form. I'm allocated 116 hours. I can choose how much I'm going to put into my Roth. You may have to add that in there. So please make sure you write in to Roth. Again, you're gonna be taxed on this. You don't wanna get taxed on it again. And so now you've gotta decide, well, maybe my spouse has a chronic illness and I know I have to take care of them, or maybe I found out, I have a chronic health issue, or my parents are ailing, whatever it might be. You don't have to sell any hours, but you can sell up to 116. And again, you'd multiply that by 2040. Make sure when you're all done, you submit that payroll to Jackie Smith, or submit the form to Jackie Smith in payroll. So what if I'm retiring or not coming back? Well, it's important to remember at retirement, you do get severance. You're paid 50% of your hourly rate. 1/2 goes to a 403B and 1/2 goes to a VEBA account, or in this case, it would actually be a healthcare savings plan. You must have 12 years of continuous service to do this. Another retirement incentive in the teacher contract is $1,000 per year up to service, up to 25, plus $5,000 for a healthcare savings plan, and this is for those staff members of 15 or more years as a full-time teacher. If you're not coming back, you may want to sell your sick leave. Actually, I don't even know if this is possible anymore because you have to sell it moving forward. I may have just come to a realization as I'm doing this. Well, at retirement, you're able to sell that sick leave. So I'm not sure actually if that's possible anymore. So I'm going to just move on to the next slide. Here is a table that lists what your hourly rate is at 50% or 25%. And these are the current salary rates. So whether you're an E1, and that should be, I should have updated that. In fact, I think I'm going to update that now. That should say E1, not T1, E1 or E2, MA or BA. Those are your hourly rates at 50% and 25%. Again, if you're going to do cash in lieu, it's going to be taxed. Or at retirement, if you're wondering whether or not you are, how much you'll get in your severance, this is kind of a nice little cheat sheet for you. Some resources to know about. You can always call Empower for 403B concerns or contact Jackie in payroll. Remember PEEP and Innovo, go to innovomn.com. They will answer the phone. I've had to call them a couple of times advocating for things for members. They're really easy to talk to. And I'll say the same thing about Benefits Extra. That's one of the reasons why we went with Benefits Extras, because of their customer care. And they have been really helpful when I've had questions. If you do have any questions, you can always reach out to me or Janet Anderson in HR or Jackie Smith in payroll. Thank you so much for your time, and I hope you have a great day.